Good morning, everyone. As Dr. Frank said, my name is Sandra Quintana. I'm a postdoctoral research associate at the College of Public Health and in the Department of Community Environment and Policy. I'm so excited this morning because I'm going to be presenting this project that I have close to my heart. I started working on this project when I was doing my MPH, and I was one of the first Global Health Institute scholar. So that's how I started working on this project. So this is a pilot study that is titled Exposure to Toxic Metals and Metalloids via Breast Milk and Stunting in Infants Living in the Lake Atitlan watershed in Guatemala. Okay, so as a background, Guatemala is one of the most culturally diverse countries and has the second largest indigenous population in Latin America. Around 50% of the population is considered Mayan. Specifically in the area of the Lake Atitlan watershed, there's three main groups that are the Quiché, the Sutujil, and Cachiquel, and we specifically work with the Sutujil and Cachiquel during this pilot study. The Lake Atitlan is the deepest lake in Central America, and is the largest by volume in Guatemala, and is of critical importance. Most of the population in the watershed depend on the lake, right? For agriculture, for transportation, drinking water, and even as a source of protein, such as consuming fish. So what is stunting, right? So stunting is the inadequate linear growth that is defined by a height that is more than 2 standard deviations below the child growth standard median. This is by the World Health Organization. This is a standard, right? So Guatemala has the highest child stunting prevalence in the Americas. And why this is important? This is important because if we take the children's life, specifically the first 1,000 days of life, those are crucial for development, especially for brain development. So it would tell us if we have a children with prevalence of stunting that they might be at increased risk of cognitive impairment, that they will be at risk for chronic diseases. And if we see it in a life course approach, this would also have an effect later in life. So what are some factors that are associated with this? Usually stunting is associated with malnutrition. Also, that is associated with poor maternal health, inadequate feeding practices, recurrent infections. And at some point, all of this are related at a distal end with poverty. So breastfeeding. Breast milk is the optimal nutrition source for infants. The WHO recommends exclusive breastfeeding in the first 6 months of life. So this means no adding liquids or even water. So breast milk supports appropriate growth and development. It's a biodynamic compound that has multiple fatty acids that would promote brain development, immunoglobulins that would support a robust immune system. So even though the prevalence of breastfeeding practices in the Lake Atitlan is high, there is limited knowledge about potential exposure through breast milk. So toxic metals and metalloids, even though the breast milk is the optimal source for nutrition for infants, it might be also a potential route of exposure. So some proteins and high concentrations of fats in milk may interact with specific environmental toxicants. So previous investigations at the Lake Atitlan have revealed elevated levels of lipophilic pesticides and also toxic metals and metalloids. And for example, arsenic, lead, they have been associated with effects in child growth and development, and they're considered neurotoxicants as well. So this is something of concern. And that's why our pilot study focused on assess the concentrations of these toxic metals and metalloids in the breast milk of women in the Lake Atitlan watershed in Guatemala, and with this generate hypotheses regarding the toxic metals and metalloids and the stunting, and this to guide further future research. Okay, so as part of the methods of our study, we did a cross-sectional study in the summer of 2022. We focused in 4 communities. Here is the map of the Lake Atitlan. We focus in Panajachel, San Juan La Laguna, San Pedro La Laguna, and Santiago Atitlan. With this, we receive funding from as I mentioned before, from the Global Health Institute and from the Southwest Environmental Science Center. And this is a community engaged research, so we have collaborations with organizations in Guatemala and with the university in Guatemala, specifically with an NGO that has been focused for more than 40 years in research related to nutrition and child development, and also with the Universidad del Valle de Guatemala. So from each community, we had a sample of 20 mother-infant diets. So our total sample was 80 mother-infant diets. So as part of the inclusion and exclusion criteria, so the infant needed to be predominantly breastfed and also be 90 to 182 days old. So this is approximately 3 to 6 months of age. This is before we introduce complementary feeding, because at 6 months it would start complementary feeding, so that's why we needed them to be predominantly breastfed. So the mother is a year-round resident of the Lake Atitlan, and they were 18 years old or above. And the exclusion criteria, if the infant was sick or not breastfeeding normally, as mentioned by the mother, they would be excluded from the study. So as I mentioned before, this is a community engaged research, so we work with the local health clinics around the Lake Atitlan, and we would have the help of community members that would help us as translators. As I mentioned, this is an indigenous population, and most of them, their native language would be Mayan, Sutujil or Cachiquel. So it was very important for us to create that trust and rapport, and that's why we had community members that would help with translation. We would complete a consent form and a survey for demographic information as well, and collected breast milk samples that were self-extracted by the mother, and we would also measure the baby's length to assess stunting. At some houses, we will collect water samples to kind of compare also the concentrations, although this was not the focus of this study. We would compensate the participants and then freeze the samples so they can be shipped to the United States for further analysis. So for the breast milk and the water samples, the ALEC, the Arizona Laboratory of Emerging Contaminants, conducted at ICPMS. The infant stunting was measured as normal quantiles for the C-scores based on the WHO height for age standards. There were 24 metals and metalloid elements that were available for analysis, and the distributions were evaluated graphically, and their correlation explored using Pearson correlation and a robust principal component analysis, a PCA. Okay, so as results, so from the infants, we had 46 that were males and 34 that were females. The mean age of the babies was 131 days old, and the mean C-score was minus 1.39. The mothers, the mean age was 29 years old, and we saw differences between the communities. So San Pedro La Laguna had a higher educational attainment, and Santiago had a higher occupational status. So now I will be showing you a graph that shows the C-scores. We can see it on the y-axis, those are the C-scores, and on the x-axis, we can see the 4 communities that we work with. The blue line is the WHO definition for stunting, and the red one is the WHO definition for severe stunting. So we can see that from these 4 communities, Panajachel and Santiago Atitlan present the higher prevalence of stunting within our study population. And now when we analyze, right, what might be the association with the exposure to the concentrations of the metals and metalloids, we found that specifically 4 of the metals and metalloids were associated with the presence of stunting. And here we can see that those were arsenic, barium, beryllium, and lead. So the higher the concentration, the lower was the C-score. And this was specifically for those 2 towns, for those communities, that were Panajachel and Santiago Atitlan. So now I will be showing you a graph that shows each of those 4 elements. Here we have arsenic, and the red line is the WHO standard for the concentration in breast milk. So we can see that all of the communities were above that concentration, but specifically Panajachel was the higher one. And we mentioned previously that the prevalence of stunting was higher as well in this community. For barium and beryllium, there's not specific standards for breast milk, so we use the ones for water. There's not much evidence regarding how barium and beryllium might be associated with child growth and development, but these are our findings from this pilot study. And here we can see for beryllium, and also it's kind of similar trend between these two communities. And here for lead, the red line also indicates the WHO standard concentration for the breast milk samples. So as a discussion, right, the concentrations of these toxic metals and metalloids in the breast milk differ among the communities, right? So it might be worth exploring what might be some differences between them. We know that they can come from the wastewater plants or agricultural practices, so that might be something that might be worth exploring in the future. As we hypothesize that the concentrations would be associated with stunting, so our results indicate that at least this is true for these 4 elements: arsenic, barium, beryllium, and lead. And the concentrations in the drinking water samples that we collected were similar to the concentrations of the toxic metals and metalloids. Specifically, they were higher in communities such as Panajachel. And this association between this exposure and stunting in the low and middle income countries has not been systematically investigated. There's some investigations specifically in Bangladesh that have found associations between the exposure of arsenic, lead, cadmium, and found some associations with stunting, but it might be worth a look further into this. So that's why it's important to do a comprehensive analysis from a multidisciplinary perspective and incorporating complexities of each of these communities and also their cultural assets so we can kind of mitigate these exposures and improve, in this case, the infants' health outcomes. So as an acknowledgement, I would like to, I'm really grateful of the community members that help us conduct this study, and also for the organizations there in Guatemala and the university. And so yes, this is my presentation of our pilot study, so thank you for your attention.